1. When preparing for the CELBAN, which principle of adult learning is most critical to ensure knowledge retention? A. Repetition without context. B. Self-directed engagement. C. Passive memorization. D. Instructor-centered delivery. 2. In curriculum development for CELBAN preparation, which component ensures alignment with exam competencies? A. Randomized practice tests. B. Needs assessment. C. Peer evaluation. D. Oral communication exercises only. 3. During CELBAN listening test preparation, which evaluation method best measures progress? A. True-false quizzes. B. Summative oral presentation. C. Formative comprehension checks. D. Vocabulary flashcards only. 4. Which communication skill is most relevant for nurses in CELBAN speaking tasks? A. Using medical jargon frequently. B. Clear and concise patient explanations. C. Interrupting patients for efficiency. D. Avoiding eye contact for professionalism. 5. Which regulatory compliance factor must CELBAN candidates demonstrate awareness of? A. National licensure standards for nurses. E. International driving codes. C. Employment insurance policies. D. Trade union collective agreements. 6. A mentor guiding a CELBAN candidate should first focus on A. Correcting grammar errors in writing. B. Building confidence in clinical communication. C. Memorizing vocabulary lists. D. Ignoring listening tasks. 7. Which evaluation strategy provides immediate feedback for CELBAN speaking tasks? A. Written end-of-course exam. B. Real-time role-play assessment. C. Peer observation reports. D. Anonymous online survey. 8. In adult learning, CELBAN preparation is most effective when A. Learners are passive recipients. B. Learners connect study to clinical practice. C. Teachers avoid learner input. D. Lectures dominate all sessions. 9. A nurse candidate practicing CELBAN writing tasks must prioritize A. Accuracy in patient documentation. B. Complex storytelling. C. Overuse of idiomatic language. D. Creative writing techniques. 10. What is the best mentoring approach to address a CELBAN candidate's low listening scores? A. Assigning unrelated medical readings. E. Providing repetitive, context-rich audio practice. C. Ignoring the weakness to build confidence. D. Asking them to focus only on writing tasks. 11. When designing CELBAN curriculum, which factor ensures fairness? A. Using standardized objectives. B. Allowing random test formats. C. Including ungraded peer tasks only. D. Avoiding clear performance criteria. 12. Which communication practice enhances clarity during CELBAN speaking tests? A. Using structured responses. B. Speaking faster to show fluency. C. Avoiding pauses completely. D. Using long, complicated sentences. 13. What adult learning principle is applied when CELBAN preparation integrates real nursing case studies? A. Abstract learning. B. Experiential learning. C. Passive repetition. D. Memorization drills. 14. A CELBAN candidate struggling with reading comprehension benefits most from A. Skimming and scanning strategies. B. Memorizing dictionary definitions. C. Ignoring context clues. D. Reading non-medical novels only. 15. Which evaluation method best supports CELBAN writing practice? A. Peer feedback with rubrics. E. Random grading with no criteria. C. Ignoring grammar accuracy. D. Oral interviews only. 16. When coaching for CELBAN speaking, mentors should emphasize A. Cultural competence in communication. B. Strict memorization of answers. C. Silence during role plays. D. Avoidance of clarification questions. 17. Which regulatory standard is directly relevant to CELBAN nursing scenarios? A. Patient confidentiality. B. Traffic rules. C. Workplace vacation policies. D. Tax filing procedures. 18. In adult learning, CELBAN candidates improve most when instructors A. Encourage reflective practice. B. Impose rigid memorization. C. Discourage learner input. D. Focus only on exam results. 19. During CELBAN listening training, what strategy ensures comprehension? A. Predicting based on context. B. Ignoring tone and stress. C. Focusing only on isolated words. Avoiding repetition exercises. 20. What curriculum design ensures CELBAN readiness? A. Integration of all 4 language skills. B. Exclusive emphasis on writing. C. Random task distribution. D. Avoidance of authentic materials. 21. The most effective feedback for CELBAN candidates is A. Specific and constructive. B. Generic and vague. C. Delayed and unrelated. Avoided to reduce anxiety. 22. Which mentoring style fosters CELBN candidate independence? A. Facilitator approach. B. Authoritarian control. C. Passive observation. D. Task avoidance. 23. CELBAN speaking tasks test the nurse's ability to A. Explain procedures clearly. B. Deliver long lectures. C. Recite textbook definitions. D. Avoid interaction with patients. 24. Which adult learning principle explains why CELBAN candidates benefit from practice in clinical contexts? A. Relevance. B. Coercion. C. Isolation. D. Passive reception. 25. A CELBAN candidate practicing writing discharge summaries is focusing on A. Professional communication. B. Informal conversation. C. Creative storytelling. D. Non-clinical narration. 26. Which evaluation tool measures CELBAN candidate progress effectively? A. Analytic rubric. B. Random selection. C. Oral feedback only. D. Ungraded peer notes. 27. Which regulatory requirement is most emphasized in CELBAN practice? A. Accurate medical documentation. B. Retail sales standards. C. International trade policies. D. Transportation codes. 28. Adult learners in CELBAN benefit most from A. Collaborative peer learning. B. Solitary memorization. C. Ignoring feedback. D. Non-contextual drills. 29. Which communication principle should CELBAN candidates apply in speaking tasks? A. Active listening. B. Frequent interruptions. C. Avoiding patient questions. D. Using slang for brevity. 30. Which curriculum approach ensures CELBAN readiness? A. Task-based learning. B. Exclusive lecture delivery. C. Ignoring communication practice. D. Test memorization. 31. The CELBAN writing test requires candidates to demonstrate A. Clarity and accuracy. B. Poetry and creativity. C. Casual text messaging. D. Storytelling exaggeration. 32. A CELBAN candidate with strong writing but weak speaking needs A. Roleplay practice. B. More reading only. C. Memorization drills. D. Ignoring speaking entirely. 33. Which mentoring practice supports reflective CELBAN learning? A. Journaling communication experiences. B. Ignoring feedback. C. Assigning irrelevant tasks. D. Avoiding learner input. 34. Which evaluation practice enhances fairness in CELBAN? A. Standardized rubrics. B. Subjective impressions. C. Random scoring. D. Peer votes only. 35. CELBAN listening tasks require candidates to A. Understand main ideas and details. B. Focus only on isolated words. C. Avoid note-taking. D. Ignore intonation. 36. Which regulatory aspect is tested indirectly through CELBAN communication? A. Patient consent. B. Real estate laws. C. Traffic violations. D. Import duties. 37. Which adult learning theory supports CELBAN's authentic tasks? A. Andragogy. B. Behaviorism. C. Infantilism. D. Passive transfer.